Good evening and thanks for joining us. Countries and companies around the world are focused on COVID-19 tonight as new cases emerge. More than 50 countries have confirmed cases of the new coronavirus now, and the World Health Organization has raised its alert to the highest level. In Iran, there are reports from hospitals of a big spike in deaths, more than 200. That is 6 times higher than the official death toll from the Iranian Health Ministry. Many believe it's downplaying what's really going on. Mass disinfection is underway at mosques and on public transit. Schools are closed for 3 days, and many flights to and from Iran have been canceled. The World Health Organization now admits we are on the precipice of a pandemic.
This is a reality check for every government on the planet. Wake up, get ready. This virus may be on its way and you need to be ready. You have a duty to your citizens, you have a duty to the world to be ready.
We'll get to what Canadian public health officials are doing to ramp up the response here in just a moment, but we begin with the stock market. It went into a tailspin again today across Asia, Europe, and here in North America. The TSX closed down 454 points, and Wall Street suffered its worst week since the financial crisis of 2008. The Dow Jones tanked today, closing a staggering week with a loss of about 3,500 points in just 5 days. It's all fueled by massive sell-offs and rising uncertainty as multinational companies downgrade their financial forecasts. Production at factories has slowed. That's paralyzing supply chains globally. And as more people stay home, stop traveling, and limit their activities to contain the spread, the pain will get worse. And tonight in the U.S., the world's second largest economy, the first hotspot for the virus is emerging. Jackson Prosco reports.
California is now the focus of COVID-19 containment in the U.S., where 8,400 people are being monitored for symptoms after a single person tested positive despite having no obvious connection to the virus.
This is a random individual in a community of 450,000 people.
The woman was admitted to hospital not far from a U.S. Air Force base where Americans were quarantined after their repatriation from Wuhan, China. A whistleblower has come forward to say staff on the base who greeted those Americans were not properly trained or protected.
Now that we're seeing it in essentially every continent, there's certainly, I think, that new attention being paid to this infection.
The lack of testing has hampered any clear sense of how widespread COVID-19 may be in the U.S. There are only a limited number of test kits. Many have been deemed faulty or unreliable.
It's going to disappear. One day it's like a miracle. It will disappear.
Yet the Trump administration continues to downplay the risk.
The reason you're saying so much attention to it today is that they think this is going to be what brings down the president.
Even as public health officials have warned the situation remains grave. Amazon instructed their employees to halt all non-essential travel. Google restricted travel to Europe and Asia after an employee in Zurich tested positive. Around the world, jittery markets continued their dive over fears of a crippling economic slowdown. In New York, the Dow and S&P racked up their worst week since the 2008 global financial crisis, wiping out trillions of dollars in wealth. While the U.S. Food and Drug Administration warned of the first supply chain shortages for at least one prescription medication. The U.S. plans to drastically improve its testing capacity within the next week, and that has officials bracing for more bad news. A sudden surge in detected cases could drastically change the outlook for the epidemic and further rattle already shaky markets. Donna?
Jackson Prosco in Washington, thanks. We keep reporting the number of confirmed cases as a measure of how this virus is spreading, but it's not giving the full picture. The only way to confirm a case is to test. No test, and you potentially leave human-to-human transmission unchecked. Disease mapping can predict what's coming. Experts at Imperial College London use Singapore as a benchmark. It was quick to impose restrictions on travel from China. It has a strict quarantine regime, and it traced all contacts with infected people. It only has 98 confirmed cases and no deaths. So based on what happened there and looking at travel patterns from the origin of the outbreak in China, they estimate about 2/3 of cases worldwide remain undetected.
Italy, we think there are many thousands of cases probably distributed across the country now. And similarly, certainly in Iran, probably tens of thousands, if not more.
Many are likely people with mild or possibly no symptoms. But look at China. Some there are developing serious respiratory illnesses and dying. not just the elderly and people with underlying health conditions. The mortality rate is uncertain, but COVID-19 does appear to be more deadly than the seasonal flu, and no one has immunity to it. And that's why Canada is now moving towards disease surveillance mode, not just passively waiting for people to show up at the hospital feeling ill, but actively looking for cases. Canada's chief public health officer has said it's similar to systems used to monitor influenza. And today, Ontario's health minister stressed the risk here is low, but preparedness is ramping up.
We actually have a command center that is set up. We are prepared. Our hospitals are prepared. We have the protective equipment we need to protect our health officials, and we are ready to move immediately should the situation change at any time.
There are 15 confirmed cases of COVID-19 here in Canada. All the most recent cases are in people who recently returned from Iran. The numbers are being updated by countries around the globe by the hour. Right now, there are more than 84,000 confirmed cases. South Korea's daily increase in cases has now surpassed that of mainland China. And Iran and Italy appear to be linked to the newest cases being detected far beyond their borders. Crystal Gamansing on the spread and the risk.
Nigeria has dealt with highly infectious diseases, Ebola, malaria, cholera, and now COVID-19, as an Italian man remains in hospital outside of the capital.
He's in high spirit, he's doing well, and we expect that he will continue to do well.
The 44-year-old recently arrived from Milan via Istanbul. Nigeria is home to more than 190 million people. A virus there can spread quickly inside the country and beyond.
The government of Nigeria, through the Federal Ministry of Health, has been strengthening measures to ensure an outbreak in Nigeria is controlled and contained quickly.
Authorities are getting a clearer picture of the web of infection. Italian cases are connected not only to Nigeria, but Mexico, Spain, Brazil, among others. Canadian cases can be traced to Iran. And then there's South Korea. A religious sect there has asked the public to stop persecuting followers. More than half of South Korean cases emerged after church members traveled to Wuhan. The World Health Organization is vigilant but still restrained in its language.
If we say there's a pandemic of coronavirus, we're essentially accepting that every human on the planet will be exposed to that virus. The data does not support that.
Meanwhile, as cases mount and the concern grows, COVID-19 has claimed the life of the first Briton, a man who had been quarantined on the Diamond Princess cruise ship. Crystal Gamansing, Global News, London.